There are instances where people may have an accident and lose a front tooth, and they want that tooth replaced. In most cases, you can't do anything unless you do an implant. You can't, when you first have trauma, you just don't drill on the adjacent teeth because they might be traumatized also. But in this case, today, we can do the extraction of the traumatized tooth that's been broken in half and also place the implant with bone graft, and the patient have a temporary restoration and look like they never had an accident. So yes, we can do extraction and implant placement on the same day.